Did you know that artificial intelligence can potentially detect COVID-19 through the analysis of cough and voice sounds? Recent studies have shown that machine learning and deep learning methods can be used to examine cough sounds of infected individuals and predict COVID-19. AI technologies offer the potential to create fast, affordable, and accessible solutions to diagnose respiratory syndromes such as pneumonia, pulmonary diseases, and asthma. Excitingly, an AI company, Resonance, has also announced that it has been awarded a $749,000 contract from the Biomedical Advanced Research and Development Authority, or BARDA, a component within the U.S. Department of Health and Human Services, HHS, to continue the development of the firm's Audible Health DX software as a medical device, SAMD. Using cough and voice sounds as a reliable diagnostic tool could provide a fast and convenient way to detect COVID-19 in both symptomatic and asymptomatic individuals. So, how does it work? Our lungs and respiratory tract adjust to respiratory infections, so epidemiologists initially listened to patients' lungs when they forced coughs to diagnose COVID-19. It is fascinating to know that automated audio recognition can help diagnose several diseases using the human cough. Now, with the help of AI, coughs can be analyzed for automated diagnosis of pulmonary diseases. Scientists have developed AI algorithms that use audio recognition to diagnose pneumonia, asthma, and other diseases with high accuracy. By taking advantage of the acoustic biomarkers as features, a framework of AI speech processing has been developed to pre-screen coughs and identify COVID-19. When it comes to diagnosing COVID-19, there are a few traditional methods that healthcare professionals rely on. The most accurate and commonly used method is the reverse transcriptase polymerase chain reaction, or RT-PCR test. This molecular test examines a patient's respiratory sample collected through a nasal or throat swab and detects the virus's genetic material, RNA. Antigen tests are another commonly used method. These diagnostic tests are swift and can detect proteins on the virus's surface in respiratory samples. Although they are not as sensitive as RT-PCR tests, antigen tests can provide results faster. Moreover, many home testing kits use this technology. Serological tests are blood tests that can detect antibodies to the virus in a patient's bloodstream. However, they are not typically used for early diagnosis since it can take some time for detectable antibodies to appear after infection. Nonetheless, serological tests remain useful in detecting past COVID-19 infections. It is important to consider the limitations of AI models in detecting COVID-19 when compared to traditional diagnosis methods such as PCR detection and immunochromatography. While AI has the potential to quickly and accurately diagnose COVID-19, these models may not always be sensitive or specific enough to detect every case or distinguish between COVID-19 and other respiratory illnesses. The accuracy of an AI model in detecting COVID-19 depends on the quality and size of the training dataset. Errors in the data or bias in the method can affect the model's sensitivity and specificity. Additionally, some AI models may be difficult to interpret and considered black boxes, which could limit their transparency and trustworthiness in the eyes of healthcare providers and patients. Although using cough sounds from individuals that underwent personal or doctor assessment may not be 100% accurate, it is still an effective way to develop AI models that can analyze a significant variety and quantity of data. This is crucial to reduce bias and improve the model's robustness in detecting COVID-19. Cough is a natural defense mechanism that protects the respiratory tract from inhaling foreign bodies and by clearing excessive bronchial secretions. As a spontaneous reflex arc, it involves receptors, an afferent pathway, a center for processing information, an efferent pathway, and effectors. During a cough, there are four different phases. As a vital reflex arc, the first of which is a part of the afferent pathway, while the last three are in the efferent one. Receptorial phase. there is the stimulation of cough receptors that are activated and accordingly send an impulse to the center through the vagus nerve. Inspiratory phase, that consists in a wide opening of the glottis by contraction of the arytenoid cartilage with rapid inhalation, which involves an average of 50% of vital capacity with wide variations in relation to the stimulus and the type of receptors. Compressive phase, that consists in a prompt closure of the glottis following the contraction of the adductor muscles of the arytenoid cartilages with consequent adduction of the vocal cords. At the same time, there is a strong contraction of the abdominal muscles and other expiratory muscles, resulting in an increased intrapulmonary pressure and compression of the alveoli and bronchioles. Expiratory phase. In this final phase, vocal cords and epiglottis open suddenly for action of the abductor muscles of the arytenoid cartilages, thereby causing the explosive leakage of air from the lungs to the outside. Subsequently, the exhalation continues, favored by the complete relaxation of the diaphragm. Knowing respiratory infection symptoms is extremely important to help doctors and technology developers build efficient and effective tools to identify the disease type. Pneumonia has some symptoms that vary among people, such as acute cough, hard breath, crackles, fast breathing, tachycardia, and fever. Pulmonary disease is a serious infection that has many fatal symptoms such as shortness of breath, fatigue, depression, swelling in ankles, legs, and hands, irregular heartbeat, chest illness, headache, fainting, and dry cough. TB's symptoms include chronic cough, night sweat, fever, weight loss, and bloody cough due to the inflammation and destruction of the airways. The wheezing cough of asthma has its main symptoms, followed by others like hyperventilation of the lungs, breathlessness, asthma attack, change birth weight, and fever. Also, other fatigues relied on limitations in day-to-day activities, chest tightness, and dizziness. Bronchitis, which is related to the obstructive pulmonary disease or COPD, is where the cough and mucus are the main symptoms. Symptoms of COVID-19 include fever, dry cough, exhaustion, phlegm, sore throat, lightheadedness, myalgia, and hard breath, while symptoms such as nausea, congestion of nose, bloody cough, diarrhea, and conjunctival congestion were rarely noticed. Cough counts and patterns were the first objective markers used to analyze cough severity and variation over time. New technology allows the analysis of both the frequency and the nature of cough sounds. For example, some algorithms first transform sound recordings into spectrograms, a visual representation of the frequency, amplitude, and time characteristics of sounds, before running an algorithm on the spectrogram to visually analyze the cough's features. This is a waveform image of the cough. This is a spectrogram conversion of the waveform cough. On the spectrogram, acoustic information is represented as frequency on the y-axis and amplitude as the color over time on the x-axis. An AI model is then trained to analyze the audio pickup by recording devices like smartphones. This can be done by using machine learning algorithms that are trained on large datasets of cough sounds and associated diagnoses. AI models can then be used to classify cough sounds and identify patterns that are indicative of certain respiratory conditions. Different research teams develop their own algorithm in diagnosing disease based on cough. This approach can help improve the speed and accuracy of cough diagnosis and enable earlier intervention and treatment for patients. During the pandemic, several groups such as OpenSigma and the Massachusetts Institute of Technology, AI for COVID-19 with the University of Oklahoma, COVID-19 Sounds with the University of Cambridge, CoughVid with the Swiss Federal Institute of Technology, Lausanne, and Sama AI research with Wadhwani AI with the Bill and Melinda Gates Foundation have used artificial intelligence to isolate acoustic pattern characteristics of COVID-19 with smartphone recorded cough and voice samples. Although successful, none of these efforts have yet been able to scale this approach into a usable algorithm for the global population. Up to date of 2021, there are almost 50 studies that analyze cough detection and diagnosis, including 8 studies that look deep into COVID-19. However, there are still challenges and opportunities in implementing and deploying AI-based diagnostics for COVID-19 that currently limit the widespread use of these tools. Despite these challenges, global collaborations have fueled continued efforts in the field. As researchers work to address the challenges presented by the pandemic, the potential benefits of these AI-based tools are driving continuous progress and innovation. Thank you for watching.